So, how do you find effective treatment for your sciatic problems, your back pain, your leg pain? Well, the first thing is making sure that you get a proper assessment, that you see someone that fully examines you. They don't just listen to your symptoms. So please see my previous video about all the different causes of sciatica, because that's the first problem and the first hurdle to getting adequate treatment. So who can you see for your sciatica and back pain? Well, there are chiropractors such as myself, osteopaths, physiotherapists, acupuncturists, massage therapists, and then of course in extreme cases there's surgeons and neurosurgeons as well. But hopefully it's not going to get to that. And there's also self-treatment, self-help remedies as well, plenty of exercises. But really you've got to try and find out what the cause of the problem is. Now, one of the most common causes of sciatica is a disc problem, a herniated or bulging or slipped disc, putting pressure on one of the nerve roots down your leg. Now, it's often thought that the best way to do this is to rest the back, the disc problem, and to take lots of painkillers and anti-inflammatories. However, this doesn't tend to get rid of the original cause of the problem. And if it wasn't an effective treatment, then there wouldn't be so many things online and there wouldn't be so many chiropractors, osteopaths, etc. helping people with back problems. Because the reason a disc becomes a problem in the first place is very often because it becomes dry and brittle, or the outer layers of it become dry and brittle. And so as the outer layers become dry and brittle, the central area, this is my model here, as this area becomes dry and brittle, it breaks and things can bulge out and hit a nerve. Now, it only becomes dry and brittle because it's not being moved enough to keep it supple, and it's not getting enough nutrients to actually suck moisture into the disc to keep it supple as well. So you have to think of this a little bit like a sponge. If you squeeze a sponge, all the liquid comes out. So in the case of a disc, you squeeze all the inflammatory things out, all the end products of metabolism, of growth, and then when it's rested, moisture is sucked back into it, which should happen overnight. But moisture can only get sucked in if you're drinking enough water, if you have enough hydration from lots of good foods full of water or good drinks themselves, and also if your disc has got all the right nutrients in it to actually suck the moisture in as well. And the only way it's going to get rid of lots of stuff is if there's lots of movement as well. Movement is really what keeps all of the disc really healthy and fit. So if you're thinking your disc is just going to get better just by rest, you're wrong, because there's lots and lots of evidence that now suggests that the best thing to do is to mobilise the disc and keep it moving, which are things that chiropractors, osteopaths, experienced physiotherapists will do. Now, acupuncture can come into this because acupuncture can be really good at relieving the pain that comes from the muscles that go into a lot of spasm when you have a lot of pain and causes extra pain. So I find that acupuncture does work really well alongside osteopathy, chiropractic and physiotherapy. Now again, if you have sciatica, a common cause of disc problems is the fact that the pelvis twists and torques. Now as it twists, it puts more pressure on the muscles around the back, and so what it does is it causes the spine to compress, and again as the spine compresses it can cause any damage in the area to cause the disc to bulge a little bit further. And so sometimes all you have to do to relieve sciatica is actually learn how to relax the muscles, get the muscles stronger again around the area. It takes pressure off the disc and you feel a lot better. So basically there's a lot of different ways to look at working with the discs to get them better. And again with sciatica, if it's something like piriformis syndrome, then sometimes just stretching it and doing some exercises to take torquing and twisting out of the pelvis is all that you may need. It all depends on the cause of your sciatica. Obviously, if there's more serious causes, you do need to see a neurosurgeon, an orthopaedic consultant, something like that. So make sure you get fully assessed. And in the next video, I will show you some exercises to try to help relieve your pain. Bye for now. I hope that helped.